Okay, so welcome to the discussion. Today, the discussion is actually the topic that made me want to start having these Zooms in the first place. We're talking about the Black mortality maternal health crisis. Um, we've seen the numbers, we've seen the stats. It's horrifying, enraging, and quite unbelievable. And today we have an incredible panel of women who we're lucky enough to have join us to have this discussion. So Sheena, my lovely partner, is going to introduce everybody. And again, to these ladies, thank you so much for joining this discussion. It's such a topic that needs to be put on a platform, and we can't talk about it or scream about it enough, in my opinion. And you all are so busy, so we really appreciate your time, and I hope everybody enjoys this discussion and shares it with everybody you know. Whatever your race, everybody needs to watch this discussion. So Sheena, take it away.
Hi, everybody. Thank you so much for joining us. So I'm just going to introduce everybody. So first we have Dr. Malawa. Thank you so much for joining us today. So she's a pediatrician and a public health professional who currently leads an initiative called Expecting Justice that's all about impacting birth outcomes for people of color. So we thank you for all that you do. And then we also have Dr. Shepherd here, who is a board certified OBGYN. She does minimally invasive surgeries, and she's also a women's health expert. And she's all about helping people see their mental health, their physical health, their sexual health, and learning all about their body. So we again appreciate you for all that you do. And then we have Jodie Turner Smith. Jodie, come on, Jodie. First of all, I saw Clean and Slim, and I was just so excited at that movie. I felt all the feels. I felt everything that I felt like I was supposed to feel, and I really feel like it really shows of how great of an actress you are, because I believed you. So when you got the British accent, I was a little confused, but I believed you wholeheartedly in your role. So we appreciate your artistry, and I'm so excited for your upcoming film Without Remorse that's coming in 2020. But I am so excited for this new baby that you have and this newborn. She's so beautiful. So tell me, I think that in this topic, I think that a lot of times people think that socioeconomic status changes how you experience racism in America, how you experience healthcare in America, and what those racial disparities may be. So tell me, I know you're also from London, and that's different, I'm sure too. But tell me, in your experience, how did you, when you were pregnant, what were your highs and your lows? What was your happy and your sad? How did you experience that?
Yeah, I mean, it's interesting because I think that that's the first thing people kind of talk about, which is this idea that somehow your socioeconomic status is going to sort of protect you from the maternal health outcomes, which is not true. And I think just in general, just as a woman, being pregnant is such a vulnerable position to be in, and already as a Black woman, with those sort of disparities that we see in the healthcare system, it's something that I personally felt a lot of anxiety. And not only that, but then during my pregnancy, COVID happened. So I had a lot of anxiety, around being in a hospital. And fortunately, I chose to have a home birth before the pandemic really swept the country up, and it became something where things were locked down and things like that. But it's when you're, I think, a woman, when you're a Black woman, your body is, and you're definitely somebody who's in the public eye, your body is constantly under scrutiny, and you're in this really vulnerable position when you are pregnant. And I think that despite how much money and access that I'm privileged to have, I still felt that vulnerability, and I still felt this need to kind of create safe space around myself. And not only that, I mean, it was something that my husband and I, as we went in meeting doctors as I was leading up to giving birth, it was something that he actually asked constantly, this is something that we know to be true, these disparities, that this idea that Black women need to advocate for themselves. How are you as a doctor, going to keep that in mind with, as we're your patients? And that was something that people were constantly like, whoa, like, why is he sort of bringing that up? But I think it's really this really interesting thing where Black women, their pain is not believed, where they're not considered in the same way that white women are, women of color aren't. And so in this space where you feel like, you know, the doctors know better than you do, to kind of feel a fear about needing to advocate for yourself, you know, that can be, you know, kind of scary, you know. And this is not to say like I'm saying that I'm against hospitals or against giving birth in hospitals. I'm saying that it's something, you know, to keep in mind. And so I feel really passionately about it, and I felt really passionately about it, especially having gone through birth. And also because what you don't realize is how much is required of you, or what it takes out of you, all of this. It's like, I think as women in general, we're sort of written off by society as what we do in birthing is just something that is like, that's women's work. You do that. Women have been giving birth for generations, and dropping babies in the middle of fields and then going back to work. Like, you need to just be able to do it and keep it moving. If women in the public eye, you need to do it, keep it moving, and snap your body back. And you don't know how much this is actually like this really huge thing that happens inside your body that takes so much out of you, that you need a lot of support around, you know. So I know I feel like I'm going on a bunch of tangents, but you know, and that, you know, Dr. Malawa, that's what I was really interested in about, you know, your project that you're doing in San Francisco, because something that I've noticed is really big is that women are not given support during and especially after pregnancy as well. I mean, if doctors recommend that your child is exclusively, you know, breastfed for the first 6 months of its life, yet maternity leave is nowhere near that, you know, how do we, like, what is that really saying about the care that women are really being offered, the support that they're being offered or being given, you know? So anyway, we could sort of jump in anywhere, but I think I thought I've answered your question. I'm not sure.
Yeah.
I mean, I think so much about how different our systems would be if there were more women in power in government, because I feel like underlying so many of these challenges is a certain kind of normalization of women kind of holding it all. And when you think about it, and there's so many studies, you know, that are recent that really show how moms have to kind of absorb all of the extra work since the pandemic hit. And there's a certain way that a lot of times women and mothers are expected to kind of be able to do the work while also doing the parenting and the household work. And it happens at the family level, and it happens at the society level. And so we don't have the systems and policies in place to support healthy child rearing and to support healthy, frankly, mothering, right? Because it's the child and the mother are not distinct, they're a dyad. And so when we want to see healthy kids, we have to see healthy families. And so part of what our program is really trying to do is trying to create environments in which families can thrive. And rather than asking families, and in particular, our program focuses on families that experience marginalization because of their race. And in San Francisco, the people who are experiencing really great marginalization such that it's impacting their birth outcomes are Black people and Pacific Islander people. And so we're kind of asking the question, what would it look like instead of trying to change these families, make them more resilient, make them more educated, you know, what would it look like instead to change the environment around these families, to change the systems around these families such that they have the full opportunity to reach their maximum health, and so that birthing people and their children have the full opportunity to have satisfying experiences as they go through this critical life change. So that's what I think is really exciting, and I really can't wait to see if we're able to produce results with this approach so that hopefully we can see it supporting more birthing people, especially birthing people who are experiencing marginalization.
Dr. Malawa, tell us about the initiative that you're doing, because I know that's what you're focusing on right now in your community is expecting justice. So tell us what we're expecting.
So Expecting Justice is a collaborative based in San Francisco that's really looking at how we can address racism as a root cause of birth inequities. And our first initiative was around how we can increase access to doula care for Black and Pacific Islander people, and particularly how we can increase access to Black and Pacific Islander doulas to serve their own communities. And part of what that work looked like was definitely finding funding, because the doulas were there, but so often in those communities, they're expected to volunteer their services because of racism. racism, Black and Pacific Islander people in San Francisco tend to be some of the lowest income families. And so a lot of times they don't have the resources to access doulas. And so part of it was creating the resources so that doula services could be available for free. And part of it was also creating a workforce through trainings and trying to integrate these doulas into the hospital so that they can be as effective. But what we're working on now that's really exciting is something called the Abundant Birth Project. And what this is going to be is a cash supplement. We're going to give Black and Pacific Islander mamas $1,000 a month throughout their pregnancy and 6 months postpartum to really, again, try and reduce some of the stress that's associated with the economic exclusion that results from racism in San Francisco. And we're just really excited to see what happens when we give these mamas the opportunity to have enough food, access to stable housing, and a little bit less stress while they're pregnant. So we'll see.
Dr. Malawa, can you talk about, this program is so incredible, and I read an article about it, and that's how we found you. So thank you so much. Can you talk a little bit about how you got that money? And to other doctors in other states and cities listening, walk us through how you went about getting that money.
Well, it's been like a 2-year journey, honestly, because the money for the program is primarily through private donations and philanthropy. And so we started applying for large grants and speaking to donors. And initially, honestly, we got very little traction. One of the things that we would hear from donors, unfortunately, is how are you going to make sure that these Black moms spend the money correctly? And underlying that question is an assumption, I feel like, that the reason why Black moms tend to be poor is not because of historical inequities like redlining or urban renewal, is not because of racist hiring practices now, but rather because we are perhaps undisciplined as Black moms or we don't know enough about money. And so we got a lot of kind of pushback and questions and doubts initially. But then we ended up applying for a grant with the Hellman Foundation, which is a pretty large foundation based in the Bay Area. And they said yes. And what that did, in addition to giving us like the starting money, was it gave us some legitimacy with other funders, I think, that were really nervous about doing an idea like this that hadn't really been tested. And so once Hellman came on board, it gave us some traction to then start to reach other people. We also started partnering with other people in the community who care about economic justice for Black people and other people of color. And so one of our partners from the Insight Center got an op-ed published in Ms. Magazine that kind of talked about some of our stigmas and narratives around Black women who receive benefits like welfare, and the need that we really address those and understand them as a form of racism if we ever want to see economic justice for all of us. And so I think that with that kind of narrative being pushed, with increasing awareness of how COVID is disproportionately impacting both Black and Pacific Islander people. And then lastly, of course, with an increased awareness in this country of the lack of racial justice, in particular for Black people, we were able to get more funds. And most recently and excitingly, we were able to get funded by Jack Dorsey's Start Small initiative. And so that really got us close to our number because we're hoping to reach 150 women over 2 years, or 150 birthing people.
That is beautiful. You know what? It makes me want to just crack a little tear because it goes to show like how much of an angel that you are, that like you're not looking to have another baby anytime soon, but at the same time, your heart is still so open to other people and helping your community. And that's beautiful because I think that half of the disparity is that people don't know. They also don't know what they don't know. And that's like huge. Like when I gave birth and I wanted to give birth naturally in a birth time, my family was like, you want to do what? Like they literally were just, and people don't understand how much certain things were pushed on us in our history. When my grandmother was younger, they pushed formula. They pushed those type of things, and they never pushed breastfeeding and things like that. So these are things that people don't know. They don't know the resources out for them. I didn't learn about a doula till I was in nursing school. These are things that with more education and more resources and more people like you that care enough to get into people's homes and really educate people, that it can be so. But it takes the practitioner, it takes the community, it takes for you to know before you get to that point. I was prepared because I'm a nurse, but that's not fair. That's not fair to anybody else. So Dr. Shepherd, like, tell me how you prepare your patients. Like, what do you do with like some of the thoughts that Jodie mentioned, some of the anxieties that they come in with? How do you feel like you prepare them mentally and educate them about their options?
Yeah, no, listening to all of this is, again, very helpful. And I think that's, again, why we need to have these thoughtful, intentional conversations, is so that we can continue to grow and better the system or better the experience. But just a little background. So through this transition, I'm actually Canadian. So moving to the US was very different for me, because I had just a different foundation of how we grew up, and the postpartum experience and the pregnancy experience is somewhat different in Canada than it is here. And so it didn't occur to me, even going into OBGYN and through residency and in my practice, that these disparities were so kind of, I guess, wide. The disparities were so wide because of a lot of the support that was not there. And that comes from the resources that, patients have access to, and also the postpartum experience. So if you think in countries such as Australia, Canada, the UK, that postpartum experience is completely different. Maternity leave is for up to a year. And so if you can imagine that type of support that families get after delivering, again, increases and kind of enriches the experience of family units, of trauma to the mom mentally, as far as like that postpartum experience, and decreased postpartum depression rates. So it took me literally going through med school, residency, and into my practice in my early years to really be like, oh, this is something, like this is real. And that came from hearing over and over and over the stories that my patients would tell me. And I was like, there is something there that I'm maybe missing or need to understand more. And that's when, obviously the literature is there. We have the statistics, we have the studies that show that. But I was like, no, I need to increase my fund of knowledge into what this disparity is, why it's there, and what I can do. Specifically as a Black female physician, I'm only 2% of the entire medical community. And so I was like, I need to do better. And I think that that's a challenge that all healthcare providers, physicians could really take when you look at this disparity mortality rates, is what can I do personally to make sure that this disparity is no more? And that's that humanistic side of medicine that we all need to do better at. And so I would definitely say, over the last few years, I've really taken a deeper dive into the whole composite of wellness, which is mental wellness and mental health, which is a big part of experiences. And, pregnancy, whether you want to label it, it is traumatic in the sense that it's good trauma, meaning you're going through a very nice process, you're connecting with another human, and that experience really should be one that should be experienced with joy, but it is rather a trauma when you think of delivering vaginally or via C-section. And then after, that mental kind of shift that takes place and not being prepared for that. And so what I think, how I prepare my patients through pregnancy, and I don't deliver a ton, but have delivered a ton in the past, is where can I meet you as a healthcare provider, and what resources can I provide for you? So that comes with the education portion, but also that connection as a human to a human. And what are you missing? What is lacking? And where can we get that for you? Because you were just saying, Sheena, lactation consultants, a doula, and you're learning that as you're going through the process of nursing. Imagine people who don't even have the luxury of going through medical school and nursing, school, to be like, oh, I didn't even know that was available. And so I find that is a big responsibility for these conversations to continue to happen, hearing personal experiences, hearing from Jodie, and then also from healthcare. I'm telling you, that is the foundation of a lot of the structural racism that we see. And, racism being a healthcare, public health issue, is the foundation of systemic racism. And that, again, it's a big thing to shatter, but I believe it can be done, but we have a lot of work to do there.
Yeah, I don't know about if you guys are familiar, but I read a book when I was pregnant, Ina May Gaskin's Guide to Childbirth. And it was a great book, and it enlightened me. It just really taught me a lot about the process. And I realized that, women used to give birth with women. And then men got involved and they just jacked everything up. You know, they got involved and said, all right, sis, lay down. Let me see. Like, nothing gotta be like, you know, it used to be mothered.
It used to be male dominated, but I will say now, like in the recent past, like probably in the last 12 to 15 years, we finally are past that 50% mark when you think of OBGYNs of females. Finally, you know, like kind of reclaiming that experience and being able to relate to that. But you're right, it used to be completely male dominated.
And it's unfortunate because the practices that males put in place are still being practiced. And one thing about healthcare is we don't stop nothing until somebody tell us to stop it. Even if it don't make sense, we'll still continue it and not really necessarily research. You know, it's evidence-based practice, but it takes a lot of work to get there. And I don't know about you guys' personal experiences, but I gave birth naturally on a birthing ball, on a birthing stool. And I did hypnobabies, which is a basically a way to meditate through labor and kind of hypnotize yourself into thinking of pain differently. So it worked for me until people started touching me, you know, another story. But but anyway, when I was on the birthing stool and after I gave birth, I noticed that I couldn't pull my son up. His cord was short. So I'm like, oh, that's a little weird, laid on the table. And I know everybody rushed in and it was evident at that point that my placenta wouldn't detach, right? So it was an emergency. At that point, I was terrified. You know, I didn't know what was happening next. I didn't know what that meant for me. And I don't tell people that I'm a nurse, so they purposely wouldn't give me any information. They just kept doing stuff, kept touching me, starting drips. Mind you, I did a completely unmedicated labor, no pain medicine. So for all of a sudden, me to have all of this stuff going on was really a lot for me. Then afterwards, and this is why I say I somewhat mourn for people that don't know, because there's so many decisions that happen in labor that if you are educated, you're able to block those unseen things that kind of can happen. But if you don't know, then you have no idea what to say no to. They make you think that every little thing, if you don't do what they said do, you know, hospitals, they have a literal checklist. If this happens, we do this. If that happens, we do that. It's not an individualized, mother-centered birth situation. So after my son came out, he had these little pimples and they were kind of cute. They were in his armpits, his subcutaneous areas, his neck, his groin, all of those things. And they were like, the doctor comes in and she goes, okay, so we're going to take him down. He'll be on quarantine in the NICU. You can come visit him and we're going to do a lumbar puncture. You're going to do what? You're going to do, so what? Mind you, I don't tell people I'm a nurse. So once I said, wait a minute, hold on. So your solution to pimples is to stick a very long needle into an hour-old baby's back and pull out cerebrospinal fluid and hope that you don't give him an infection and paralyze him for pimples. And you think that that's the best thing to do, the first thing you should do, the most non-invasive thing that you should do. And of course, she's surprised. I'm 27. I just got married. I'm a young Black girl. I'm sure that maybe she didn't expect me to have that knowledge. I said, no. What you're going to do is you can quarantine yourself from coming in here. When your nurses come in, they can wear a gown. And actually now my baby's not going to leave my sight. What we're going to do is we can culture one of the pimples. You can see what's inside of it because that will be the non-invasive and the smartest thing to do. And then we can figure out how to go from there. But you can exit. Come to find out, baby was fine. The pimples popped and they became freckles and he still has them today. Not a big deal. But the point is you were willing to stick in a perfect child, and I consider newborns perfect because they literally come out exactly what they need to have. These are perfect individuals that you're sticking a needle this long into his spine to do, really? And that was the moment that I realized that, wow, I guess I was a little blind to it too. And I'm like, wow, there are people that would have said yes because they knew no better. And me having the knowledge, I was able to say, no, that's not smart. But somebody else said yes to that and their baby went through that and could have had an infection, could have been paralyzed, could have been hurt. And just the pain of it, they fold the baby into a donut to do it. It's terrible. So just having that knowledge is so important. And I feel so bad for women that don't have it. And it's just unfortunate that you kind of have to damn near educate yourself to that level just to have a safe birth. It's unfortunate.
I do think, though, that is also why it is so valuable to have an additional birthing support person with mothers. And, one thing, for my pregnancy and birth, I had a doula because I decided to do a home birth. I had a midwife, before I didn't decide to do a home birth until I was 35 weeks, about 35 weeks. So I had an OB as well. And my OB continued along the journey with us all the way through. I mean, he was present at my birth, even though my Black midwife and doula were like, you can just stay over there in the corner and we'll start this. But he was there just in case anything happened. Now, I'm aware that I am definitely a person who has, who had the money to be able to afford that, who had the access to be able to have that. But it really has sort of shown me that because, in the absence of having a person who's there, who can sort of advocate for you, because even you think about Serena Williams, and she had she was getting the blood clots, and she told them what her medical history was, and she kept saying like, this is a problem, and I know it's a problem based on what my medical history is, and nobody was really listening. And so how important it is. And so what I'm wondering, because number one, I really, because I felt so passionately about this since I gave birth, like, okay, every woman should have access to having a doula. Whether you're birthing at home or in the hospital, like every woman should have access to having a doula. And then this idea that when you have a midwife, the mother is checked on up, after the birth. And when you don't have a midwife, your OB doesn't check on you until it's been, I think, 6 weeks is the first checkup. So doctors, both of you, do you see sort of this, is there ability, how do we kind of meld the holistic, with the medical in this way so that, you can have mothers feel that there's somebody who is advocating to do something that's non-invasive, so that you can have mothers feel like, the first step is kind of educating you. When the doula is there, the doula really is there to kind of look after the mother, whereas the midwife and the OB are really more there, like they're all about baby. So how do we kind of, what is a solution that we can kind of see creating that would, kind of cut some of these issues off at the head?
I think one of the things is always integration and collaboration, and that might need to come in the form of, Dr. Malawa was saying, funding as far as outside resources other than the actual medical community. Because I think, when I think of being a doctor, I think, Sheena, I was listening to your experience. We are so trained to be there for instances that could go wrong, because that's what we're trained to do. And so sometimes I think the conversation can be different with what we're seeing during childbirth, after childbirth, but we live in a world of when the worst is going to happen, sometimes we're really focused on making sure that that bad outcome doesn't happen. And so when you were saying, the placenta wouldn't detach, in our head, we're like, if placenta doesn't detach, or if it detaches, or if it's attached to the actual myometrium, that could be really bad. There could be hemorrhage. Does she have any medical history? So we're so like super focused on the issue and making sure that that outcome doesn't go from like a level 6 to 9 to 12 all of a sudden, which can happen in childbirth very quickly. And that's one of the reasons that, it's hard for us to detach from having hospital births or epidurals in a controlled setting, because we know what can happen very quickly. And we see that very often. And so that scars us. And, I do think that physicians have that kind of that spirit of, when you have a bad outcome, it scars you, and you remember, as an OBGYN, I remember some of the, intrauterine fetal deaths that you've had, or neonatal deaths that you have. And in our head, we're like, how can we prevent that from ever happening? So that's why we're so trained to like respond on the second, because we know that maybe in a few seconds or a minute, something really bad can happen. I think some of our training can acquire more of a conversation, or having people understand why we do things, or giving them options and understanding what comes with those options, the risks. But looking at how we can integrate doulas, lactation consultants, a mental health provider after delivery, working up into that 4-week or 6-week visit when they see us, really, I think is one of those grassroots type of projects that could happen. I think that would be actually very ideal, because we know what the statistics are with postpartum depression, postpartum hemorrhage, all of the things that really can be catastrophic. So prevention is key, and prevention comes with adding resources to the entire experience. So I find that I can do as much as I can in the office setting, which sometimes is not conducive to, the programs like you're recommending, Jodie, but I think that they're very viable. I think that they are something very attainable, but it would have to be done from some type of funding or grant. And I think that the metrics that you would see from that type of study or looking at that would be so magnificent, and you would see such a significant decrease in some of these outcomes that we're seeing, that it would be very easy to then, see some organizations and insurance companies start to cover those services as well.
I want to think about history when I think about the answer to that, because the first history I want to lift up is actually the history of the tradition of granny midwives. And maybe a lot of people don't know in this country, but for a long history, like centuries in this country, the responsibility of delivering and making sure that deliveries went safely mainly fell on Black women in this country. The birthing traditions that many Black slaves brought with them from West African countries were some of the best birthing science and technology that this country had. And so it wasn't just Black women that delivered with these Black granny midwives. A lot of times it was all races of women, because that was one of the best ways to ensure a good birth outcome at the time. And so I just want to lift up, especially for Black women that listen to this, that we have this knowledge and this tradition around this integration that you were describing, Jodie, as part of our cultural heritage. And so part of what we need to do is just lift up what our culture already knows how to do, and what we need the larger society to do is make space for this wisdom, right? And to honor this wisdom, even though it's coming from a source that this country historically has not valued. So that's the first history I want to lift up. And then the second history I want to lift up is the history of gynecology in this country, which many people maybe don't realize, but the quote unquote father of gynecology was actually a white man who developed a lot of his surgical techniques on unanesthetized slave women. So when we look at what happens in hospitals around obstetrics and gynecology, we have to remember the history that this practice came from. This practice has never had a tradition of respecting and honoring Black bodies, right? And so until obstetrics and gynecology truly unpacks that history, then we can't begin to expect to see this kind of healthful integrative care in the system. And I'm not trying to diss my colleagues, because certainly throughout all medicine, including in pediatrics, there's a ton of white supremacy embedded within all of Western medical practice. But in particular, obstetrics and gynecology has this very challenging history of developing practices on unanesthetized slave women, and also displacing these granny midwives and invalidating them as a way to rise up as an official specialty. And so I think that we need to kind of really evaluate what hospital birthing culture looks like, and how we look at Black women in our society if we want to start to see some of these changes in birth outcomes.
And I really, admire you for saying that and calling it out like it is. And also understanding we have it's like we literally have all this literature and studies that show that there is a huge disparity when it comes to Black women. There has been really, if you think about it, nothing that's changed. And so that really, again, and just keep saying it, that systemic foundational racism is really where we need to take a really deep look at. If you think of medical school trainees, when you kind of dig deep on what they think or how they would treat a Black woman versus any other woman, it's somewhat like it was taught, but it wasn't written. It's something that was kind of infused through training, and now that's how they practice. So it's very in the subconscious. And, I've seen it in colleagues, I've seen it in med students, as they're rotating and they're reporting, I guess, on, on a patient, and then what their expectation of what the plan should be, or what they should or shouldn't for pain medication, or what they should and shouldn't offer them for a delivery plan. It's those subtle things that start very early on, that then that person, as they start their career, if no one's really corrected it, they will continue in that fashion, not even understanding the basis of why they chose to treat a person a certain way. And so, to me, that systemic racism is such a big part of what we see in medicine, without people really understanding why they choose the things that they do, or how do they choose to treat one woman versus another. And usually you're going to see that with Black women.
The other thing that's so scary about this situation is that, and Sheena and I have done several other conversations, is that Black women and men are leaving academia in record numbers because of the racism. So this really is a problem that needs to be just addressed with as much noise as we can muster, because for accomplished physicians to to go into academia and want to put their message forth and want to teach better and want to rewrite wrong systems, if they don't even want to teach it because they can't handle it, because it's been too traumatic for them, you know, that's an outcome we cannot be satisfied with. We can't be okay with that. And so why are Black doctors leaving academia? You know, that is something that really, there's a conversation, Dr. Kali Cyrus, who's a psychiatrist out of DC, we did a conversation with her, I think our first conversation, and she's doing, they're having a roundtable discussion about it with a group of doctors that have left academia. So I think that's another topic that we have to shine a light on, is why are these Black doctors leaving academia, and who will be left to teach our white doctors and our Black doctors.
And that goes to representation, and the fact that the representation already, we quoted what 6 to 7% of physicians are African American or Black, 6 to 7%. And so if they're leaving academia, it's that transferring of education and knowledge that's leaving that as well. And we're going to see that that's only going to create a greater disparity in what type of information is transferred and taught. And that's very sad to hear that, but it is very true.
And I think that the biggest thing that sometimes that we miss as humans is that we always exclude ourselves from anything negative, anything that makes us uncomfortable. We always, when we hear people talk about these racial disparities, us as nurses, doctors, healthcare professionals, we never want to think that we're a part of the problem. But I gotta say it, the problem is too widespread, way too methodical, and way too ingrained for us all not to be a part of it in some way. And that's why each and every one of us, every shift I leave and I say, wait a minute, did I do that? Was that, you know what I mean? Like those moments to take a minute, like there's so many nurses, there's so many, first of all, there's so many maternity wards that have not one Black nurse there. And maternity is, and I don't know how it is with doctors, but maternity amongst Black nurses is a very hard field to get into. I tried to get into maternity several times. I applied to several hospitals in my city. My resume is, you know, a pretty good resume, and never was able to get in. I called, and I remember being, when I first became a nurse and I was a telemetry nurse, I told someone, I'm going to apply for the maternity ward. And they were like, they'll never let you in. They don't let in Black nurses. And that was, you know, with time, it became to be something that was very obvious and true, that a lot of our maternity wards are mostly white nurses. And if white nurses don't believe the statistic, they don't believe that they're a part of the statistic, and they don't believe that they contribute to it at all, then how do we fix the problem? And not blaming them. I'm not blaming anyone. I'm just saying that we all need to take inventory every single time we leave the hospital, while we're in the hospital, and think, check your biases, check your thought processes, check why you're doing the things that you're doing, check yourself and think before you leave, because again, the problem is way too widespread for us all not to play a part. We all want to think that we're not a part of it. We all want to be good people, and I'm a good person. That could never be me. Being a good person is an active thing. You can't deem yourself a good person. You actually have to do good things. So that's taking a second to reevaluate and be self-aware into how you're interacting with people, how you're providing care, making sure that you're providing care equally, and making sure that you're providing the same resources. Don't assume anything about me. Just give the same care, no matter who you're speaking to, whether they're a doctor, whether they're a nurse, whether they're a garbage person, whether they have their mom at the bedside, whether they have no one at the bedside. You need to give them the same care and self-evaluate. That's a part of our job too. But if we never want to admit that's a problem, we never want to admit that we're a part of it, we can't get anywhere.
I think human nature, you know, is not to want to experience feeling that that layer back that might reveal something about yourself that you don't like. And it's much easier for people to kind of displace that and not think that they're a part of the problem. So if we could get, all to a point where we're able to see some of the things that we can all make changes in, every day, just like you said, Sheena, it's our responsibility to ourselves to say, today, what did I do to or not to contribute to that one particular issue? But kind of race in general in this country is something that people do not like talking about. It's very uncomfortable. And it's much easier for people to want to remove themselves from that conversation than actually go head on and discuss what things need to be changed and how they're a part of that problem and being a part of the solution.
And that's why, me personally, you're not going to stop me from speaking about it at the nurses station. You're not. Guess why? Because this is where we should be talking about it. Not at home with our peers and friends that are not nurses, that can't help it, that can't save anyone, that can't change anything. No, we need to talk about it at the nurses station. This needs to be an open conversation. If Black women are 3 to 5 more times as likely to die in childbirth than white women, then that should be upfront just as much as if we found out that, I don't know, drinking too much water in pregnancy would cause some type of issue. We would say to ourselves, you know what, we need to put this at the front and talk about this, and we're gonna create some evidence-based practice. We're gonna set up this, we're gonna do this, we're gonna create a plan in action to be able to stop this. But yet and still with racism, oh, you can't talk about that. Oh no, that makes people uncomfortable. Oh, talk to your manager. Don't talk to nurses individually, or don't talk. No. I'm gonna talk about it here because y'all not the ones dying. So I'm gonna make sure that my peers know where I stand on it, and my peers know that we're gonna hold each other accountable here for these people's lives, because that's my job.
And leadership needs to be a part of that accountability. And that's where I see a lot of times where it's lacking. And going back to why we see Black physicians leaving these institutions is because many times they have been in situations where they're like, well, then let me go to the leader or the organization and kind of discuss this on a bigger level. And they're not able to, or they're told that whatever they discussed was not necessarily true, or just, that was a misunderstanding. So over and over, you're being kind of displaced. And so therefore it's an issue that you realize will never be discussed on top level. And if it's not discussed on top level, then why would any policy be changed on the units or the floors or the OR? Why would that be changed if no one deems it important?
I want to mention really briefly that I think one of the things that makes it difficult for a lot of us to talk about racism, and I include myself sometimes in this category, although I've grown a lot, is that in this country, we've constructed it that only bad people are racist and good people are never racist. And so if somebody is bringing up, hey, you just had a racist impact, what you're hearing is, oh my God, I'm a terrible person. I might as well just throw a white hood on my head and march around with a torch. And so what we need to start to do is recognize that all of us who have been exposed to, frankly, American media have been socialized to be racist. And the job is not to pretend or hide that fact, but rather to authentically figure out how is that manifesting in my interactions, and how can I start to dismantle that internally? Because, I want to own that I am a Black woman, and I want to own that I have been socialized to be racist. And I want to own that there have been moments, probably on a weekly or monthly basis, when I recognize that I showed up in a way that had a racist impact, although it was not my intention. And so part of what the work is for all of us, but especially providers, because the stakes are so high, I think is really kind of being willing to make peace with the fact that our intentions and our impacts are not always going to line up, but our work is to get them to mesh. Because I think that if we could do that, then when people like Jodie's husband bring up a conversation like, can we talk about how racism might impact my partner's birth outcomes, then hopefully the doctor would be willing and able to respond to that regardless of their racial background. So I want to ask Jodie, what would have been the right response? What would that have looked like? How would you have wanted your doctor to respond when you guys brought up that issue?
I mean, definitely this idea of acknowledging the existence of bias. I think that the one thing that you don't want to hear as a Black woman, and when you're raising this issue, or as the partner to a Black person who is going to birth, you don't want to hear somebody sort of gaslight you in that moment, well, you know, that's not true, or that's only happening to these women because of the fact that they're poor, or they're, you know, they're not of good health. That, which is something that I hear a lot, and I would really love also for you doctors to touch on that as well, because I think that there is this misconception that it is because Black women or women of color, Indigenous women are unhealthy, that the maternal mortality rate is what it is, and which, is, we know, is just not true. And it doesn't matter how many times we have huge cases in the media where a woman who was, you know, of good standing, you know, socioeconomically, is dead at, you know, during or after birth, or that we hear, you know, a celebrity give their own account of, you know, coming close to death, that we sort of still just have these ideas that it's the fault of the mother, why the mother's why they're dying. And so the last thing you want to hear is for your provider telling you that. And, you know, the important thing to note is it's not an accusation of you are a racist and what are you going to do about this. It is more something where you need your healthcare provider to acknowledge and understand that you're going to need everybody who's in that room. Everybody who's in that room while you're giving birth needs to be there advocating for you. And you want to feel that way. That's how I wanted to feel, you know.
That you felt with your midwife? Did you feel like they were like protective over you, like they had you?
Absolutely, you know, and that's the thing. And so that's, you know, and I think that's another misconception, because a lot of people think that being able to give birth at home is something that also comes out of privilege, when, you know, the reality is giving birth at home is actually a lot less expensive than giving birth in the hospital. But I think it's going back to what Dr. Malawa was saying in terms of this ancient knowledge that we have as Black women already. When I was in that birth ceremony, I recognized that these two women were operating from a place of knowledge that was passed down from ancestors, and literally doing God's work in the way that they held space for me, in the way that they advocated for me, to me. Because that's the other thing, as a mother already, in while you're birthing, you know what I mean, there are so many times where I felt like, I don't know if I can do this. You know, your body is going through something so remarkable and so challenging and so difficult, that it is like, and so unlike anything that you have ever experienced, except when you were actually coming down the birth canal, which you don't remember, that you are just, there are so many times where you feel like, at least where I felt like, I'm not sure that I can do this, especially that I didn't have the support of using drugs to support me, you know, the way that an epidural does. You know, I didn't have any of those things to kind of like, you know, support me in getting through what is physically taxing about birthing. And I mean, these women, the way that they held space for me and empowered me, and the way that as I saw them work together as a team, my midwife and doula, I was just like amazed at them. I remember so many times having these moments where I was looking at them and just thinking, these women are angels. Like, this is what they do for their work, is support women like this. And I mean, for my, you know, process, because, and I don't know if you guys know, you know, I've shared before, you know, my labor was very long. You know, I was in early labor for days. And so it was like, you know, my contractions were far enough apart that I was not considered yet to be in active labor, but intense enough and frequent enough that I didn't sleep for 3 days. It was very difficult for me to eat, because I just was like, you know, I think everybody here knows what I'm talking about. So it was really intense. And it was something where I just thought to myself on many occasions, like, I don't know if this is something that I can actually get through and do. And to have these two women who were really just supporting me and letting me know that, like, you can do this, we can do this without intervening, your body is doing it. And, you know, I also did have my OB there. So it's like, and so that's why I was talking earlier about this idea of, you know, how do we marry the holistic with the medical? Because I think, if anything, it creates this really beautiful combination where it's like checks and balances. Because, you know, my OB in his position was very much wanting to intervene at many points during the process, and really being like, I mean, just walking holes into the floor, just like, we should go to the hospital, you know. And I wasn't
We
aware of
can't
it.
help it. We can't help it. No,
You know what I mean? And I get it, because you're coming from where the obese coming from, where the midwife is coming from, who's just like, we're going to let the body do this. But it's a really beautiful, in a way, almost checks and balances that could happen if we could found some way to create this for all women, where you have somebody who is focused on the holistic approach, but somebody who is also focused on the medical approach, and to make sure, like, constantly that everything's okay. Because, you know, the midwife, we were constantly, you know, checking to see what the baby's heartbeat was doing, always monitoring what's going, letting the doctor also sit to have his peace of mind, occasionally checking me to see that, like, you know, we are still living inside of these boxes that we will consider still being safe. But while we're sort of pushing it in terms of what maybe a medical person may feel is a little bit too long, we're making sure that we're staying safe. And it's like having that balance. Now, granted, in my position, I was able to afford to have that balance. But for many women, obviously, they cannot afford that. And I mean, as you were saying also, Sheena, I didn't know what a doula was until actually I went into the process of birthing. I had heard this word out in the ether, but I had no knowledge of what this person was and what this birth person did for the mother. Another thing, you know, can we talk about postnatal, postpartum care? You know, a postpartum doula I also had, because, you know, emotionally what you're going through, I mean, when you feel that, you know this in sense of, we all learn biology, but you don't really know and have this concept. I didn't really know and have this concept of this idea that your organs move. You know, there is literally this, after I gave birth, I could feel like this emptiness, this space inside of me. And emotionally, how that impacted me and what that felt like, and how just there were so many moments when your body is so different than what it was before, and what it grew to be over 9 months, which was also something that was just like, whoa, feeling at home in your body again, how difficult that is, honoring the fact that your body's just gone through this. And I had a postpartum doula coming and doing sessions and just really holding my body so that I could just sometimes lay there and cry, sometimes just sleep. All these things that I feel like are so important that mothers really need. And how do we get insurance companies to get on board with supporting women and having these structures around them? Because I mean, and maybe you guys can really speak on how important those things are and what it really is required. Because that's the other thing, nobody tells you what you're going to need for postpartum, or even how you're going to feel, or even the fact that you're going to bleed for 6 weeks. You know, I mean, I felt like I had done so much research, but somehow when my midwife told me that right after I'd given birth, I was like, what? You know, and but it's like, but of course it makes complete sense, but it blew my mind, you know.
And
I think there, I'll go ahead, Sheena.
Just before you, one thing that I will say though is that there are two things that you made clearly that made a difference in your situation. Is one, you had support, and I think that is huge, and I think that it's so disheartening to know that there's so many women out there that go through something as challenging as this on so many different levels and have no one to call, no provider or practitioner that even cares enough to give them the time of day. There's been plenty of times where I cried in my GYN's office before, when I was a young and didn't have kids yet, and I would just be like, are you even looking at me? Do you even know I exist? Hello? Like, not even really reverencing my presence or really caring about what I was actually going through, and not having that support. And two, there were moments in your situation where you looked up and saw somebody that looked like you. And that's huge when it comes to support, because when you have, and don't get me wrong, support can come in any form. I'm not saying that it has to look like you, but it is I have patients all the time that say like, thank God you're here, I'm gonna live now. You know, like, people really feel like that, you know? So, and I think it's an understandable feeling to feel like that. When you see a Black nurse or Black doctor, Black doula, Black midwife walk in the room, you feel a sense of like, okay, at least I know there's one barrier that's not here. At least we can cut out some of life's issues. And I think that it's so important that you had that kind of support around you. And like you said, I wish that it was available for anyone. But Dr. Shepherd, what were you going to say?
Yeah, no, I was just going to say, you know, hearing your story, Jodie, is wonderful, because that's obviously not the world that I live in, right? So we live in very calculated, very, you know, this is what's going to happen. And And so I love to hear these stories to center me and to balance me as far as, when I do have these situations, to allow for people to have the experiences as what they may want, asking them questions about what options they may want that are not traditional medicine. But just from hearing, what you're saying as far as how to integrate that, which I'm a firm believer, I love integrative wellness of looking at evidence-based medicine, because to me that's very important as a scientist, is to know like what has been shown, what has been studied, but also accounting for holistic and what our bodies can do and what we can allow our bodies to experience. I think those are two different categories, and I think they do so well when they integrate with each other. But is to actually hear more from your experience from a patient perspective, because there are many patients who don't know that this is even something that they could do or experience, or know that those resources are available. And I think that there are very transcendental parts of the birth process that we've lost that. I think, not just in medicine, I think just in society, it's become a very calculated type of thing. I have patients who are just like, I don't even want to do a vaginal birth. I want a scheduled C-section, which is completely fine because that's what they choose. But I think that, even having that option now, when before it used to just be a vaginal delivery, like there is no epidural, there is no whatever, it's going to be you birthing. And so as we've kind of like moved throughout, society and medicine, and how we've really seen technology advance and birthing process advance, now you have all these options, but we have lost a lot of kind of hearing about that experience of what you went through and having a home birth and making sure that it's safe and making sure that there's checks and balances. So I do think that there's an education portion to all of this, is allowing women to hear and see and acknowledge that this could be their birthing story as well.
In our society, that in the United States is a white supremacist society, I'm not saying that every American is a white supremacist, but what I'm saying is that this country has very much been rooted in racist practices and continues to perpetuate them. One of the manifestations of that is—
Sorry, I have to interrupt you for
Please.
a moment. I'm going to get emotional because I'm so emotional. Jodie helped me. She's an actor. She gets it.
I believe in emotions.
What's heartbreaking about this conversation right now to me is that every time any of you have to speak and say this is a white supremacist society, you're almost having to apologize for saying that, saying, I'm not saying all white people are racist. The fact that you are afraid that you're going to offend some people breaks my heart. And this is where the work needs to be done. This is why white fragility books exist. This is why it continues. Because I'm not saying you're fearful, but you're being mindful not to offend people. We have to get offended. Sorry, white people. I'm sorry. You have no idea even this much about what it really means to be offended. So to hear all of you speak about your experiences and have to tiptoe and be mindful of possibly calling somebody a racist when you're not calling them a racist at all, and that's not what you're saying. It just, for you to have to make space in your thoughts, in your mind for that, just makes me emotional. And I just want to acknowledge it, that this is a white supremacist society. Every institution, medical, legal, everything has been built by white men. Everything. So if that bothers you, just please take a deep breath and continue to listen to these conversations. That's all we can do, is just listen. No one is trying to call you anything, and no one is trying to offend you. They are trying to talk about their experience. And if for some reason that experience, you can't connect with it, or it doesn't seem real to you, then you need to just continue to be quiet and listen more. I'm sorry, Zaya.
No, thank you. Like, really, thank you. So then, okay, real talk. Real talk is that in this white supremacist society, we don't value many types of wisdom, and in particular, the kinds of wisdom that come from not white males. And so what that means is that biomedical science is considered what is real, what is true, and other forms of wisdom will never reach that level of validity. And one of the ramifications of that is that the only way that we can see to create safe births is through our biomedical knowledge. But Jodie has already lifted up that there are many kinds of wisdom that need to come into play when we're trying to lift up healthy births. And as long as we're stuck on this white supremacist idea that only biomedical knowledge should be paid for by insurance companies, should be valued, then we're never going to see that integration that you're hoping for. And so on that same level of real talk and sharing some wisdom from some other places, I want to talk to the white identified folks who might be listening to this. And I want to talk about what is your work here? Because so often white identified folks feel like their work is that they are allies to addressing racism. How can I be your ally, Black people? But from where I sit, white people's job is to dismantle white supremacy, and you are not an ally to that work. That is your central work. And in recent months, I've had some really hard conversations with well-meaning white people who have told me about all of the books that they're reading and maybe even the petitions that they're signing. And then they feel like that's where the work ends. And where the work doesn't extend to in particular is having hard conversations with people who they are in relationship with about those people's racism. And what that can look like is having that hard conversation with your co-doctor or co-nurse who is showing up racist. That can also look like having that hard conversation with your spouse or your uncle or your aunt who is voting crazy. That can also look like having a conversation with your fellow PTA members that are doing a ton of fundraising for your fancy school at the expense of other schools that are populated by people experiencing racism. And so sometimes when I'm in dialogue with well-meaning white people and they say things like, oh, I can't talk to them, they'll never listen to me, or these things like, oh, I tried and then they said, you know, that's fake news, so what could I do? I get really scared, frankly, because I'm like, oh my God, you're our allies? You well-meaning people who won't actually do the hard work are our best chance of dismantling racism? Because if people of color could dismantle racism, it would be gone by now. So what is apparent to me is, unfortunately, this is not entirely within our control. It's not entirely our ability to lift up. Unfortunately, we're gonna have to rely on white identified folks to help dismantle this system. And so I wanna remind people that we're not just talking about people having, you know, like a hard experience at the grocery store when we're talking about racism. In this conversation, we're talking about the literal lives of mothers and babies. I want people to really think about, what does that mean for a family to be bringing home a new baby without its mama, for preventable reasons, for just the simple reason of racism. I want you to think about, what is the experience of carrying a baby for 9 months, giving birth to that baby, and then losing that baby for preventable reasons. I mean, we know that there is nothing more traumatic that a birthing person can go through than losing their child at any age, but especially in that tender moment that is supposed to be this empowering, sacred experience. And so it's like, what I'm asking white identified folks to do is to move past what you perceive as prohibitive discomfort into a state of action. And what that action looks like is calling politicians. It means moving for real dollars, not some like $50 donations here and there. But if you can afford expensive houses, then you can afford to move some real dollars. If you can afford private school, then you can afford to donate to kids who cannot afford private school. I'm asking you to authentically move resources, to authentically use your political leverage on behalf of not yourself, and to have the hard conversations, because we as people of color can't reach other white folks in the same way you can. And that is the only way we can resource programs like mine, and it's gonna help a small group of people. But if we actually wanna see something different in this country, and it's not just for Black women, we all benefit when our babies are born healthy. We all benefit when mothers are having healthy experiences. We all benefit when our hospitals become safe places for everybody, right? So I'm asking white identified folks to get on board and do the work if we wanna see the kind of world where everybody has a healthy birth. That's real talk. And thank you for giving me permission, Ellen.
Amazing, because you're right. And you know, this really resonated with me, exactly what you're saying. When the George Floyd incident happened and everyone wanted to be an ally and an advocate. And I was like, let me tell you something. As a Black person, I cannot dismantle a system that I did not build. Racism was not built by Black people, and Black people can't dismantle that system. And therefore that is your journey, that is your challenge to dismantle that system that was built a long time ago by white people. And it's that offensive thing, Ellen, that you're talking about. When you say things like that, they feel as if you're attacking them, and
they're not doing anything. Why do you get so defensive? If
I don't know.
Like, oh, with me, I didn't, well, then why are you so upset? Why are you so defensive? If you don't do anything, then you're good. What's the problem?
Well, it's because we're all complicit. They can help
dismantle it.
But we're all complicit.
Yes,
we're all complicit in the system. And so that is the problem, is that all of us are complicit with our inaction. And so when people say, I didn't do anything, that's not enough. It's not enough to not be racist. I need you to actually take active action to dismantle it. And almost all of us are complicit in not dismantling it. But in particular, if you're benefiting from the system and then you're complicit in perpetuating it, yeah, you might be a little bit uncomfortable when you authentically confront that fact, you know?
Mm-hmm.
I think that Jodie's experience, it's giving me an idea, you know. It would be amazing if there's any, Jodie, can I ask, was your OB or white?
Yes.
Was a white man?
White man, yeah.
So I think there's an opportunity here for women or for nurses or doctors or whoever, pregnant women, whoever is watching this. It's a wonderful idea to bring up to your OBs. If you're a white woman, if your OB is a white woman, if you're a white woman and your OB is a white man, if anybody, this is a wonderful idea to talk to these OBs about. Have a conversation. Hey, this would be a great thing to add to your practice. It would make your practice feel more inclusive. You would be offering a better service to your patients, to have these things available to them, to have these doulas and midwives and post doulas to be part of your practice as something, a service, a spiritual service that you could offer to your patients, white or Black. I think would only make doctors' practices look better. The doctors would look more empathetic and more in touch. And I also think it's a good idea for white women to hear that there are Black women who have ancient wisdom of birthing babies who can help you in your process. And maybe that's an idea that will help you see things in a different light. To think about this for a second, white women are so probably used to having white OB, white nurses, that it never occurs to them, well, go seek out a Black doctor, go seek out a Black female OB. Oh, wait. Oh, you don't want to do that? You don't want to have a Black doctor? Does that make you feel uncomfortable? Because that's how Black women feel. You know, it's like, I challenge white women to go seek out a Black OB. And I challenge white OBs to incorporate Black women, doulas, midwives into your practice and support what they do, because they want to support what you do. And not to take the Black practitioners and the Black midwives and doulas away from the Black community, because they serve them and we need each other. And that's amazing that they're there for each other. But I just challenge white folks to step outside of your comfort zone and think about being more inclusive in your birth plan, in your practice, if you're a practitioner. And let's just start to widen the scope of what our circles in our surroundings look like, because that might help change your perspective.
So I've been trying to control my face for the last 5 minutes because I've been trying not to ugly cry, but you know, it's so hard to talk about this because I am the first, like, you know, before I became a nurse, I didn't know any other nurses or physicians or people that were in those type of positions. So, you know, I have so many people around me that say, like, I'm scared to get pregnant because I'm scared to give birth. I'm scared I'm going to die. I'm scared that this is going to happen. I'm scared that, and these are real fears for people. And the fear and turn causes more of a risk, because then they're scared to open up. They're scared to say what's wrong. They're scared to ask for things. They're scared to go to outside practices. They don't know what's available to them because they feel like, okay, I can't ask that. I can't get on their nerves. When you're giving birth, you are so vulnerable. Literally, I kept looking up like, can y'all tell me I'm okay? Because I'm actually not sure. Can y'all tell me I'm all right? You know, especially, of course, everybody's situation is different, but when you're in an unmedicated birth, it literally feels like your body is leaving you. Like you don't even know if you're here. So, you know, to be in that situation, and that's why I say I almost mourn for these women, to be in these type of situations and not have that support and that care. And I know so many women that go through it. It's like, you know, there has to be a point that we all just take a self-reflection moment to really think of how we can impact this, because that is not okay. And like I said, it leads to people making even more poor decisions because they're scared to speak up. And then here's the worst part. If you speak up too much, then you become the patient that's annoying. And then they're not gonna come in your room anyway. You know what I mean? Then you become the patient that like, they don't wanna go see. They don't want, oh, here she comes again with her stuff. But it's like, wait a minute, these are my rights. This is my body. This is my baby. I have to protect myself. I can ask you whatever question I choose. I can tell you what will be and what won't be in this process, because giving birth is something that healthy people do. And I don't have to necessarily always do it your way. You know what I mean? So it's things that things that I said no to in birth. Other people were like, oh, I didn't know you could say no to that. Yeah. You don't have to. I said no to Pitocin. I said no to those things. I said, no, I'm okay. My body's going to do what it was meant to do. You know, no, don't do that. Don't touch me here. Don't. And of course, you never want to be seen as the negative person in the but why is that negative when you're Black? Why is being Black something that automatically strips you of speaking and saying, no, I don't want that, or yes, I do want that, or that's not appropriate, or no, stop, explain that to me. Don't just, I'm not following you. Those moments that I knew to do, but other women didn't. And that's where the support comes in at. And it just, you know, it breaks my heart that so many women are terrified to give birth, have so much anxiety that it almost ruins their experience. Giving birth is supposed to be beautiful. It's supposed to be mesmerizing. It's supposed to be one of the best days of your life. And for so many women to come out of it feeling like they had a traumatic experience in a negative way, and to feel like they want a redo of something that you can't redo is just, it's sad. And, you know, I appreciate all of you women for giving us, Jodie, your experience. I know you're not a health professional, but your experience really is teaching us something. I've never heard of a midwife, doula, and an OB in one space. Like that's it right there. Like y'all make a practice and do that, you know, do that more often, get together.
I was like, I can sign up for that.
Yeah. You know, that's serious. And that's why these conversations are important, because you don't know what's available until you talk to other people. Apply pressure. Like this is what it's all about. And we have to be together and work together for a common goal.
What's interesting is that, you know, I didn't even know that was going to be what was possible, because we ended up, when we decided to have a home birth, we just immediately went and like started interviewing midwives, and we didn't know that like you don't have the midwife and the OB. And then when we told our OB that we wanted to have a home birth, he was like, oh great, I do home births, because not a lot of OBs do home births. So then suddenly it was like, and you know, my husband asked me, and you know, God bless him, he very much was a person who was like, whatever you need for support, like you can, and he was like, if you want, he was like, we don't need them both, but if you want them both, you can, you know, we'll make sure they're both there. And I was like,
well, then your husband is the one who has to start this whole, he's the one who's going to spearhead this, this change.
You know what I mean? I'm like, talk to your fellow whites, husband, and show them how it goes. No, but what's so interesting, and as we talk about this, because, and Dr. Shepherd, I really want to hear from you about this. I think, you know, because one thing that I really noticed was the most important thing is, in order to feel safe, you have to feel either that you have somebody who is able to advocate for you, or in the case of Sheena, because you're a nurse, you're able so well to advocate for yourself. But there may be women that are watching this right now that are pregnant, that are planning on having a baby, and that, like you were expressing, Sheena, like, because I've heard the same thing, so many women, and I know when I have posted things about the comments that I've made in my own birth, you know, I've seen many people write comments where they're like, I'm scared. You know, so what do we say to women that are getting ready to give birth, and how do we empower them to advocate for themselves? Like, what things should they be asking? What things do they need to know so that they can feel empowered to advocate for themselves in the birthing rooms?
I think that sometimes when you think of the physician-patient relationship, there is this level of intimidation, not like it was brought on by anyone in particular, but it's this kind of intimidation factor that comes along without anyone really saying that's what's going on. So I always advocate for patients to be transparent. Transparency always helps. Just like you were saying, those two words, I'm scared. A lot of times people don't like to say those words and from a patient perspective. And so sometimes their questioning or what they might say or not do is an outward kind of transference of I'm scared. And so because we're not hearing that, we're trying to place, well, I wonder why they're acting like we're trying to have this conversation and it's not meeting. And so I always try and take a step back as a physician and say, what exactly are you feeling? Or why is it that you might ask that? Or trying to like get that conversation started. And a lot of times we don't take time in whether it's an office visit, whether it's a surgery, whether it's a birthing process, to ask questions to the patient to help understand them better. So a lot of times it's a very one-way conversation. So I always advocate for patients to be transparent and say what they feel. I'm scared, I'm angry, I'm upset, I'm frustrated, whatever that might be. And then also taking the time to say, I need you to explain that further. Many times patients do this when we talk, and in our head, we're like, oh, they understand what we said. And in their head, they're like, I don't know what you said. And so then there comes that dialogue that's not happening that we think, oh, they're okay. So saying, can you explain that again? Or I don't understand. And that was where that feeling of people might feel from a patient perspective that they're inferior because they don't get it. Absolutely not. That is not your job always to get it. Your job is to make sure until I explain, until you understand, then that's my job. My job is to be able not only to deliver medical care, my job is to be able to explain it. And if I'm not doing that, then I'm not doing my job. And so I advocate for anyone who's listening, who's been in that situation where they feel, one, they're afraid, anxious, disappointed, frustrated, to voice that. And also, if you don't understand, it is, again, in your right, like Sheena was saying, decisions and options that you might have in a process to say, I don't understand, can you please explain that again? And not feeling intimidated by using those words. But that's how we can start to further those conversations, because if we're seeing this, we're like, oh, that's great, they get it. But sometimes a lot of people are not getting it. And that's our job to make sure that you understand that. And if you are with a provider that you've now asked that question and you're still not getting, or there's just a complete like dismissal, like, well, I'm not explaining that again, then you have the right to find another provider.
And that's what I was just going to say. I think that there are so many physicians that care, that explain, that teach back, that make sure that you understand. And there are plenty that don't. So you have to take responsibility over your care and force that person to explain it to you in a way that you understand. Because a lot of times they'll say, oh yeah, so we're gonna perform an episiotomy. And you're like, Next thing you know, you hear you're like, oh shit, wait a minute. So the point is that like, you have to like, no, what is that and why? And do I have to get that? And then
is there an option?
Exactly. Is there an option? What happens if I don't do that? You know what I mean? What is my care? What is my healing process? What may or may not happen? Also, there are so many other options. If you do choose to go with a nurse practitioner or a midwife, that's also an option. There's also practices where they have everybody in one swoop. That's a practice that I went to where they had nurse practitioners and OBs in the same situation. And they were all your GYNs throughout life anyway. So you kind of like knew them. And, I had a relationship with them. So when it was time to give birth, she was like, all right, girl, come on. And it was just like, we had an experience, and I had a great birth. I gave birth in 4 hours, unmedicated, and it worked out, but I had my bumps in the road too. So when it comes down to it, knowing your options, knowing that there's a doula, knowing that there's resources out there, and so many women change who they go to at 35 weeks, like Jodie, 30 weeks, because they realize, wait a minute, this ain't working. If you go to someone and you don't feel a connection with them, you don't feel like they understand you, you don't feel like they're taking time to really care about you and show you that they care, this is a space. There's a lot of things you can go to doctors for. You got a UTI, go get you some little meds, cool. But this ain't that one of them things. You need to be comfortable. You need to know that that person cares about you. You need to know that that person is listening to you, and you need to feel heard. So make sure that's the first step that we can take. If you don't know anything else, at least, and there's plenty out there. My sister has one of the most amazing midwives, NPs she works at Hackensack Hospital. She's all of that, you know what I mean? So it doesn't necessarily always even mean color, but it's just a principle that find people that are going to listen to you. So with that being said, ladies, I appreciate you so much for coming. Me and Ellen are a hot mess. We halfway cried through this whole thing. This is not how we're supposed to be, but we got through it, and we just thank you so much, because you brought a perspective that we couldn't bring just from talking, me and her. And me and Ellen had these conversations all the time, and it's just beautiful when we can see our conversations that we had together manifest and bloom and birth these little babies of manifestation all around us. So we feel so blessed that you guys were able to give your voices, and you all came with such a unique addition that really made the situation just beautiful. So I encourage everyone out there to do your due diligence. And for those practitioners, can y'all join up and make little baby practices of dream teams so that we can have Thank you so much, ladies. Ellen, did you want to say anything else?
I do. I want to thank all the women so much. They're all so busy, and everybody just had gems, absolute gems of wisdom, and couldn't be more grateful. But, as far as me being a mess, everybody should be a mess about this. How can you listen to the fear in Black women's voices, in minds, in hearts? How can you listen to this and stand by and not be a mess? How can it not affect you? So, I'm going to sit in my tears, and I'm okay with it, because I don't know how you hear another woman's pain, something we can all relate to, whether you've had a child or not. We're all maternal in some way. And how you listen to another woman's fear and pain, and that doesn't break your heart. To hear that women are in fear for their lives because of the color of their skin, if that doesn't break your heart, well, then you have some praying to do. I'm okay with my tears. I'm okay with my
So now they started again. So I think the point that we were trying to say is that you should feel some type of way because you're a human. You don't have to be a Black woman to say, you know what, that sucks, and we should do something about that as a human first. Then as a woman, if you're a woman, then as a mother, if you're a mother, then as a practitioner. You don't have to be me to say, you know what, we need to put an end to this. That's the part about racism that is so scary to me, that you can look at another person's plight and not care just because of the color of their skin. If I see a baby that needs help in the middle of the street, you think I'm gonna walk past because they're green? I don't care. I'm gonna pick up the baby and be like, what's going on? Is everything okay? Where's the mom? We need to care, because we should care, because we're human. So if you can walk past this conversation and feel like it doesn't apply to you, you need to reevaluate. Get it together. You know what I'm saying? Because this is serious. And, listen, the tears, we both were yellow. We both tearing. We just, thank you so much, ladies. This is like really I don't think we could have had a better conversation. And I appreciate you guys from the bottom of my heart for making time. I know you have crazy schedules. Jodie, we appreciate you and that beautiful baby. We wish that everybody else could have seen how cute she is. But thank you guys so much. And we really appreciate you.
Thank you. Sending you all so much love.
Thank you. There's resources that I want you guys to connect to this. So like, for instance, I really want people to know that there's something called the Birthing People's Bill of Rights, and we just created something called the COVID edition. And so like, for instance, because there's a lot of people who have Medicaid and they may not be able to choose their provider. And so we want you to know what are your rights going into a birthing setting. And while any birthing person can use this, we made this for Black women at the center. I also want to lift up, there is a book called Battling Over Birth that was made by a group called Black Women for Wellness. And it's based on a bunch of interviews done with Black people from the Bay Area to understand what their birth experiences were. And at the end, there's calls to action for providers, for community advocates, for patients, for family members. And then lastly, I want to lift up an organization called Black Mamas Matter Alliance. And this is an incredible alliance of Black justice, birthing justice advocates. And on their website, you can again see a policy agenda. And so when I was asking for people to really step up, I want you to kind of have some marching orders. And any of those places can kind of help you kind of figure out what your work might be, even if you don't identify as a Black birthing person yourself.
Thank you, Zaya, because that's really important. A lot of times people leave this conversation like, well, how do I do that? So thank you so much. And we'll definitely, when we post it, we can list some of those things, those points that you had too. So that way it'll be there. So no worries. We'll make sure that people know about this is super important. And, shout out to you. You have an angelic spirit and we really appreciate all the work that you do. We know that it's not easy, sis. It's not easy. So we thank you for that.
It's really my pleasure though. And thank you so much for this opportunity to be able to share this time with you guys. It's been really inspirational.
Absolutely. Thank you so much. This has been enlightening. Every moment that I have in these conversations, I learn, and I value each and every one of your perspectives and your ideas. So thank you.
Yeah, thank you all for having me. I mean, honestly, it's as a person who just recently gave birth, going through that, what it did for me is it just really lit this passion inside of me to do something. And whether beginning with a conversation is always great, but there's just so much more that I want to do in terms of making sure that women have support through the process of birthing, because having done it, and what has been so clear to me is how much is missing, what is missing for women and how much is needed. And I think that how much money you have should not be what determines how much support you're able to have access to. Every woman should be able to have access to a doula. Every woman should be able to have access to a postpartum doula. And I mean, that is the bare minimum that I think that women should have. And I just feel very passionately about it. So thank you for letting me be able to come here and have this conversation with you guys. And I look forward to really figuring out how I can do more.
Oh, we appreciate you guys.
Thank you.
Thank you.